Barbara here. High blood pressure, not a good thing, but 1 in 3 adult Americans have it. Don't want it? Trying to avoid drugs? Well, let's talk. First, what is a normal blood pressure? It's 120/80 or less. Anything between 120/80 and 139/89 is considered pre-hypertensive. So that's moderate high blood pressure. High is anything over 140/90. Now, lots of you get confused about the numbers, so let me do a quick explanation. The top number is your systolic. That measures the pressure in your arteries when your heart beats. In other words, your heart muscle is contracting and it's active. The bottom number is diastolic. That measures the pressure in your arteries between heartbeats when your heart muscle is resting. Now, in the past, most attention was paid to that bottom number because it shouldn't be high if the heart is resting. But it's now recognized that both numbers are important, especially if you're over 50. That high top number can indicate risk for cardiovascular disease because it rises due to stiffening of the arteries and accumulation of plaque. Okay, do you want to hear what experts have said you can do to naturally lower blood pressure? There's quite a few things. You can pick one or more, but here they are. First, hormones. Now, you know that's my favorite thing. Don't let them get unbalanced in the first place. But if you have high blood pressure, Dr. Kenneth Stephenson has shown that progesterone 20 milligrams per day, that's only a quarter teaspoon of a nice progesterone cream, for 12 weeks can lower your pressure. And Dr. Marina Johnson said progesterone is great, and you could also use topical estrogen. That's the hormone side. Now you're going to switch to unrefined Celtic sea salt. You don't have to be afraid of Celtic sea salt. It won't raise your blood pressure like regular salt. As a matter of fact, it's filled with minerals. CoQ10, the higher levels protect the heart. You want 100 to 200 milligrams a day. Vitamin D, if you have low levels, it can cause hypertension. So I like 2,000 IUs daily. Magnesium, wonderful for the heart, 200 to 600 milligrams. Your fish oils, I hope you're already taking those. Those are very, very good. Olive leaf extract, 500 to 1,000 milligrams a day, and I've got the studies on that one. Kyolic garlic, what is it? It's a milder form of garlic. It's aged and it's antioxidant rich, and a study showed in 12 weeks taking Kyolic garlic, it's a little capsule and it won't make you have garlic breath, can lower your numbers by 10 or more. Hawthorne berry, that's one that dates back to the 1st century when it was used for high blood pressure and hardening of the arteries in the olden days, and it's still valuable today. L-Arganine is good, especially for men. It reverses deficiencies of nitric acid. And there's a spice called curcumin that relaxes vessels. And you can either use the spice or you can get it in a capsule. But I like the spice. These are natural supplements and they can all help, but I know you're smart enough to not go off your BP meds unless you check with your doctor. But if you add some of these, you might find your dose can be lowered, or in the best case scenario, you won't need them anymore. Before we go, I want to tell you about foods, because there's foods that lower blood pressure, and my favorite one is chocolate. You want 70% cacao or more. You can make sure it's at least 70%. There's some that are 80 and more. It's antioxidant and flavonoid rich and can lower blood pressure after 18 weeks. And you get to eat chocolate. But you only need 1 square of the good chocolate to get the results, so don't go overboard. But I love dark chocolate, and you can eat more than 1 square. Bananas, we all know they're potassium rich, but here's a little secret. For a great treat, take a banana and slice it. Now you can either freeze the slices individually, or you can put peanut butter in the middle of them. And you could even dip them in some melted dark chocolate and then freeze. And that can be your snack. Beans, wonderful for magnesium and potassium, but don't be boring. There's black, white, navy, lima, pinto, kidney. They're chock full of fiber too. And you can eat unsalted sunflower seeds to get magnesium, 1/4 cup. And spinach contains potassium, magnesium, and folate. There's wonderful ways and things you can do with spinach besides just old Popeye having it out of the can. So there you go. No high blood pressure for us. And if you want this information in writing, you email me. Thanks for watching.